President Trump has just now nominated his third CDC director, and her name is Dr. Erica Schwartz. And you need to know who she is. And, she's walking into something that may be a little bit chaotic, definitely disruptive.
So MeidasTouch just highlighted Trump's third CDC director nomination. And this perfectly illustrates how political interference is destroying public health institutions. We're watching the CDC collapse in real time while measles outbreaks surge. This breakdown matters because your family's health depends on these agencies functioning.
But what happens to her if she cannot stabilize this agency already under extraordinary strain?
I'm Dr. Ide Brown.
And I'm Dr. Sonia Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. And so today's episode is about the nomination. But it's also about what happens when an agency has lost its stability and whether or not one doctor has the judgment and the courage to rebuild that trust. So we're going to be talking about Dr. Erica Schwartz, who she is, what she's walking into, and what you need to know and watch for during her Senate confirmation hearings, because what happens next is going to affect all of us.
The confirmation hearings will be crucial because senators need to determine if Schwartz can resist Trump and RFK Jr.'s anti-vaccine pressure. The last director who tried to maintain scientific integrity got fired. So this is essentially a test of whether science can survive political loyalty demands.
Erica Schwartz holds a medical doctorate degree from Brown University, 8 years of liberal arts from medical education training, along with a law degree and a master's in public health. I mean, she is definitely qualified for the position. She spent more than 2 decades in public health, the U.S. Public Health Service Commission Corps, and she's already also served as the Navy, rose to the Rear Admiral in a short amount of time and became the Coast Guard's chief medical officer. So in that role, she oversaw a large network of medical facilities and helped shape pandemic preparedness, the policy, before COVID became a household word.
Her pandemic preparedness experience is actually perfect timing, given we're dealing with active measles outbreaks right now. But qualifications don't matter if she caves to political pressure, like we've seen repeatedly. The question isn't competence, it's whether she'll prioritize science over Trump's demands.
Remember, the first nominee was former Congressman Dave Weldon, and he withdrew before his confirmation hearing even began. And then the second person was Dr. Susan Monarez, that was the career public health scientist that we really did want. She was confirmed and then removed because why? She clashed with RFK Jr.'s policy over vaccines. Remember?
This pattern reveals everything about Trump's approach to public health. Weldon withdrew because he knew he couldn't defend his anti-vaccine record. Monarez got removed for doing her job correctly. Now Schwartz faces the same impossible choice: loyalty to Trump or loyalty to science.
She was definitely, the person they probably needed at the time. It was whether the scientific judgment and political pressure can coexist inside the same agency. And so after Dr. Monarez's acting leadership signed off and stepped down, major changes affecting what? Childhood vaccination policies began. And those changes were later challenged in federal court.
The legal challenges prove these policy changes violated established public health law. Courts had to step in because the CDC abandoned evidence-based decision-making. That's how we got from a functioning agency to thousands of preventable measles cases spreading across the country right now.
So the CDC data released earlier this year showed thousands of confirmed cases in 2025, and the outbreak has continued into 2026. We're in April now, and it's rip-roaring, as you say. The risks are no longer theoretical.
These aren't future projections. Measles is spreading right now because anti-vaccine policies created gaps in herd immunity. What started as political posturing has become a genuine public health emergency affecting real children in real communities across America today.
Eb Ori, who resigned later this past year, described an agency around 20 political appointees, some that were known, documented anti-vaccine views, controlling external communication and contracts. And now that's the agency that Dr. Erica Schwartz has been nominated to lead.
20 political appointees with documented anti-vaccine views controlling CDC communications means scientific data gets filtered through ideological lenses before reaching the public. This is exactly how authoritarian governments manipulate health information to serve political narratives instead of protecting citizens.
So when vaccination systems weaken and the outbreak does not stay in one place, which it's not going to, it spreads into schools and homes and clinics and the emergency room. And the communities least equipped to absorb that, of course, absorb it first. So public health is not an abstract. It's a daily infrastructure question of who gets protected, who gets seen, and also who gets ignored, of course.
This perfectly captures how public health failures cascade through society. Wealthy families can afford private health care and homeschooling alternatives, but working class communities depend entirely on public health infrastructure. When the CDC fails, inequality literally becomes a matter of life and death.
So there are Republicans, including some who are deeply uncomfortable with where Kennedy has taken this health policy, who see Schwartz, Dr. Schwartz, that is, as a stabilizing choice, right? They want to reset, and that does matter. But it also means expectations are extremely high and scrutiny is going to be intense because the last director who tried to protect scientific integrity was removed.
She's caught between Republicans wanting competent governance and Trump demanding ideological loyalty. The previous director's removal sends a clear message. Scientific integrity equals job termination. Schwartz has to choose between protecting public health and keeping her position. An impossible situation.
So when she sits before this Senate Help Committee, here's what must be answered. Number one, what specific actions will she take in her first 90 days in the middle of this measles outbreak, right? Number two, does she believe in recent changes in the childhood vaccine policy and if they were grounded in scientific evidence? Number three, if directed to suppress or delay public health data, will she? Because that's what RFK Jr. and or Trump will probably advise. And then number four, how will she rebuild this trust with the public health scientists who've been fired, resigned, or silenced? And lastly, how does scientific independence, what does that mean to her? And how is she going to protect that from the Trump administration?
These questions are designed to expose whether she'll be another Trump loyalist or actually defend scientific integrity. The 90-day timeline is crucial because measles outbreaks require immediate response. Any hesitation or political calculation could literally cost children's lives during her confirmation process.
And I'm going to say it because no one else is, but it's going to take a Black woman, a disruptor to say it. They want a Black woman to fix what they've messed up. I'd use another word, but we're, public, whatever. Yeah. So the credentials that cannot be verified by just a resume, the one that matters most right now is her courage.
This follows a disturbing pattern. Appointing Black women to fix crises created by white male leadership, then expecting them to navigate impossible political pressures without institutional support. It's the ultimate no-win scenario disguised as an opportunity for representation.
The courage to say no when science demands it, the courage to protect the institutions bigger than one appointment, the courage to remember who is watching. And the people watching tonight and parents checking their child's vaccination records are up to date. That's what matters. And she's up to get a huge, surmountable infrastructure right now.
The human stakes couldn't be clearer. While politicians debate ideology, parents are checking vaccination records because they know their children's lives depend on CDC guidance being based on science, not political calculations. That's why courage matters more than credentials here.